In this video, I'm going to be demonstrating proper technique for the cervical traction exercise. So this is an exercise that all of my patients I have you do before getting adjusted, as well as I have you doing this at home every day. And this is one of the exercises that I like to describe as spinal hygiene. That this is a beneficial, or this exercise is beneficial for anybody, whether they're under chiropractic care or not under chiropractic care. The purpose of this exercise, well, there's a couple of purposes. One is to be able to stretch the ligaments and the muscles that are surrounding the spine, which is why I have my patients do it before getting adjusted. It helps to loosen up the spine before the adjustment, which helps me to be able to shift the spine a little bit more gently. Now, another beneficial aspect of this exercise is that it distracts the vertebra. It pulls the vertebra apart. Whenever you pull the vertebra apart or distract them or do traction, it pulls fluid into the discs, which are the little pads between each vertebra. And when you pull fluid into those discs, it increases the mobility of the discs, but it actually stops or slows down degeneration or arthritis from occurring in those joints. So in order for you to have healthy joints, healthy discs, this exercise can be and should be done every single day. I recommend doing it immediately after you wake up, do some of the traction, and then at the end of the day. I think those are the best times, but really doing it once to twice a day forever is beneficial for the overall health of your spine. So whenever you set up the cervical traction, first, you want to, of course, set it up for the proper height. Now, a good height, whenever you have it set up, either here in the office or at home, is that you want the chin piece here to be slightly above where your chin is if you were looking straight ahead. So if I'm looking straight ahead, you can see that the chin piece is higher. I want my whenever I put it on, I want to have to look up slightly for my chin to be able to fit on that chin piece. The reason you want that is it's going to make it a slightly tighter around the neck, which means I'm not going to have to bend down as far when I'm doing the exercise. Now, I have nothing wrong with my knees or my hips or my spine or my back. So personally, I can squat pretty low and it's fine, but especially for people who do have problems, the lower or the less you have to squat is better. So this piece is going to go behind my neck, this thin piece here. The thicker piece is going to go under my chin, as such. Now, when I'm doing the exercise, I'm going to be squatting down as if I'm sitting in a chair. So I'm going to be going down like this. And I'm going to show you in a second what I don't want to see. I'm going to be going straight down. That's the goal, straight down. I'm going to hold for about 1 second, and then I'm going to stand back up. And that is the proper way to do the exercise. Now, something that I don't want to see when we're doing the exercise is don't want to see you leaning away from the wall or into the wall. The goal should be straight down. So occasionally what I'll see is people doing something like this. This is not having the traction effect that going straight down is. So when I go straight down, it's pulling the head up. When I'm leaning backwards, it's not giving me the same traction effect. And potentially could be a little bit more risky, so to speak. Hopefully, when you're doing this at home, it's nice and secure in the door. And of course, here it's bolted in my wall, so it's pretty secure as long as you're using this correctly. Now, I do also want to say briefly that occasionally people have TMJ issues or jaw issues. And it makes it hard to put this under the chin because it does pull up on that jaw and it compacts the jaw. So the best way to do it is under the chin, but if you do have any sort of TMJ issue, jaw issue, it's uncomfortable doing it down here. Another way to do it, a modification, is to put this piece right on your forehead, kind of right above or at the eyebrow level. So I'm going to demonstrate that as well. So I put it right here. Now you would want to raise it up a little bit to be able to do that. So I'm going to do that right now. Actually, that's as high as it goes because I'm pretty tall. All right, so right there, and then I would do the same, try to go straight down and then back up. And that is a modification on how to do the exercise. Now, if you experience any pain or discomfort on the back of the neck, in particular on the little bumps that are on the back of the neck, they're called the spinous processes. If you have any pain or discomfort on those, that's the purpose of these little, I call them donuts. So what we would do in that case is we push these things in as such. And these are a bit softer. There we go. So we push those in a little bit. Leave a little space in between the two, and that's meant to take the pressure off of those little spinous processes on the back of the neck. So we're going to put this behind the neck, just as we did before. This goes under the chin, and then we would do the same movement. And it gives a little more padding to make it more comfortable back here on the neck. If you're doing this in the office, please, when you're done, push them out again. So that is how you do the cervical traction and why you do the cervical traction. If you have any questions, please ask me or anyone who works here in the office.